Hello everyone, my name is Nick Wolf and today I will be doing my Exercise Science 486 case study on muscular dystrophy. So to begin, what is muscular dystrophy? Muscular dystrophy can be any one of the more than 30 genetic diseases that are characterized by progressive muscle weakness, defects in muscle proteins, and eventual death of the muscle cells and tissue, resulting in degeneration of skeletal muscles. Symptoms include, but are not limited to, waddling gait, pain and permanent shortening of the muscles, extreme loss of muscle tone, and difficulty walking, talking, or even breathing. So, a quick, brief epidemiology of muscular dystrophy. The first historical account of MD dates back all the way to 1846, where they thought that this person actually had an extreme version of pneumonia, but as the research progressed and more cases of real muscular dystrophy came about, they were able to determine that it is in fact its own disease and were able to trace that first disease all the way back to 1846. So Duchenne muscular dystrophy is in fact the most common form, and it affects 1 in 3,500 male live births every year. The other most common forms of muscular dystrophy are Becker, limb-girdle, and myotonic. At the moment, there is unfortunately no cure for muscular dystrophy, but as we're going to find out, there are ways to be able to stymie the disease and make it possible for people with it to live as normal as a life as possible. So, Duchenne muscular dystrophy. This is in fact the most common form of muscular dystrophy, like I previously said. It is caused by an absence of dystrophin, which is a protein that helps keep muscle cells intact. The disease normally begins its onset between the ages of 3 and 5, and it usually affects boys only. DMD is in fact a sex-linked disease, so the genetic component that causes the disease is normally only something that affects males, about 90 to 95% of the time, but there are some rare cases where it affects girls as well. It is the leading genetic killer of boys worldwide, and Becker muscular dystrophy is a less severe form of Duchenne muscular dystrophy, and this form of the disease begins in your late teens and it is slower and less predictable. So while those two forms of muscular dystrophy are the most common, there are other forms of the disease that, although rare, are really important to mention. So first we have myotonic muscular dystrophy, and this form of the disease is characterized by an inability to relax muscles following a sudden contraction. This affects men and women generally between the ages of 20 and 30. Next, we have congenital muscular dystrophy, and this is from a defect in the myrosin protein, and this form of the disease causes many of the classic muscular dystrophy symptoms that we see in Duchenne muscular dystrophy and Becker. Then we have Emery-Dreifuss muscular dystrophy, and with this form of the disease, symptoms usually begin by age 10, but can appear in patients up to their mid-20s. People with this form often develop heart problems by age 30, and they may die in mid-adulthood from progressive pulmonary or cardiac failure. Then we have limb-girdle muscular dystrophy, and in this form, weaknesses develop in the lower body and lead to lower body instability, and oftentimes there are a lot of falls associated with this form of muscular dystrophy, and the effects of falls are often very prominent in these people. Then we have distal muscular dystrophy, and in this form of the disease, we typically see that it appears in adults between the ages of 40 and 60, and it affects your forearms, hands, and feet. Then we have the fascioscapulohumeral muscular dystrophy, and this form is characterized by difficulty opening and closing eyes and your mouth, and it is often accompanied by sway back of the spine. And finally, we have oculopharyngeal muscular dystrophy, and this typically appears later in life in adults and can lead to losing the ability to walk. So, living with muscular dystrophy. Fortunately, modern medicine has made it possible for those with Duchenne muscular dystrophy and Becker muscular dystrophy specifically to live until their 40s and 50s and even beyond. The keys to optimizing life with muscular dystrophy are as follows. It is really important to make sure that you prevent contractures, which pretty much are when the tissues surrounding your joints become rigid, and it is really the main reason that people with MD lose their ability to have proper range of motion. It is important to utilize modern bracing and assistance technology, and it is extremely important to participate in regular physical therapy and occupational therapy, cardiac and respiratory care, and exercise as much as allowed by your physician/exercise specialist. So, for the case study component of this presentation, I have James, who is a 14-year-old boy currently suffering from Duchenne muscular dystrophy. After being diagnosed at age 7, James began an aggressive routine of PT and OT, cardiac and respiratory rehab, and regular exercise, which helped to control the severity of the disease. Last year, James moved to a new town, and his family stopped his treatments as it was difficult to find a new group of doctors, therapists, and exercise specialists that really understood James well. James has been sedentary for the last 6 months and has seen his condition deteriorate. He wants to be able to lead as physically normal of a life as possible and has come to you for help. So James is a 14-year-old male. He has no family history of cardiovascular disease. He is a non-smoker. He has been physically inactive for the last 6 months. His BMI is 24.3. He has a good blood lipid panel with an LDL value of 29, an HDL value of 68, and a TG value of 92. And his fasting blood glucose is in the non-diabetic range at 79 millimoles per liter. James is currently experiencing pain when walking in his hips and decreased range of motion in all of his joints and has contractures in his knees and elbows. So, exercise testing for those with muscular dystrophy. In order to accurately prescribe exercise to those with MD, it is really important to establish baselines to start with. Establishing such baselines is critical in preventing injury to those with muscular dystrophy, as oftentimes very little weight, resistance, or speed is necessary at first. So for this specific case, I have the following protocols is what I would do. For the aerobic protocol, I would prescribe a submaximal multi-stage graded exercise test with 1-minute workloads. And I would have James stop when 75% of his heart rate reserve is reached. For muscular fitness, I would recommend a variety of movements at light weight, performing reps until failure. This would allow for estimated 1-rep maxes. And for flexibility, I would recommend performing a variety of functional flexibility tests, such as sit and reach, hamstring, hip internal, external rotations, etc. For flexibility, it is really important that these tests be thorough and extensive, as lack of mobility is a major issue that those with muscular dystrophy suffer from, and it is one of the main reasons why they are not able to live a normal life. So for the actual exercise prescription, to begin, muscular dystrophy can be a challenging disease to prescribe exercise for, and that is really important to note. However, by implementing the following protocol to the best of your ability, you can give your client the best possible chance to improve their fitness. So, for this specific case, I have, for cardiorespiratory exercise, James should be prescribed aerobic activities 4 to 6 days per week at 50 to 80% of his heart rate reserve for 20 to 40 minutes. His goal would be to increase and maintain aerobic fitness and increase strength of the cardiorespiratory system. For the modes of this exercise, I would recommend cycling, rowing, arm ergometry, or assisted treadmill, and that they would depend on what is available and what James feels comfortable with. For strength and resistance exercise, I would recommend starting at a low resistance, approximately 50% of 1-rep max, and go for greater than 10 repetitions. For the mode of the strength resistance exercises, I would recommend free weights, machines, and body weight as all viable options. And for flexibility, the flexibility exercises should be performed daily and held for about 20 seconds per stretch in order to increase range of motion and prevent issues which are commonly associated with muscular dystrophy, such as contractures, arthritis, etc. Flexibility must be extensively evaluated and prescribed accordingly, with an emphasis on improving range of motion in all of the joints that affect the daily activities of living. So, with muscular dystrophy, there are some important special considerations to keep in mind. As muscular dystrophy is often a complicated disease with varying special characteristics, it is really important to be well read on what specific form of MD you are working with. For example, some specific considerations that are disease dependent are: it is important to beware of cardiomyopathies in those with DMD, BMD, and some forms of limb-girdle muscular dystrophy. It is important to beware of cardiac conduction defects in those with EDMD and myotonic MD. And it is important to make sure that when muscles are weaker than anti-gravity strength, formal weights are pretty much useless, and it is important to remember that the goal should be to exercise through whatever the available range of motion is, and then to gain full range against gravity. And one really important thing to note is it is important to remember to always tell your clients to listen to their bodies. Do not exercise if movements are painful, and always allow 48 hours in between exercising the same muscle groups to allow time for those muscles to properly heal. So, in conclusion, all forms of muscular dystrophy are serious diseases that must be taken extremely seriously. With the advances in modern medicine, it is possible for those with muscular dystrophy to live relatively normal lives, and it is possible for them to be able to participate in regular activities of daily living. Each year, those with muscular dystrophy are continuing to defy expectations, with many people going on to college and starting families and getting full-time jobs and living life to the best of their abilities. But it is extremely important to follow the proper protocols that are set forth by your doctors and your exercise specialists in order to make sure that that does happen. Exercise training is extremely important for those with muscular dystrophy, and training your muscles and improving your flexibility and cardiovascular endurance can be the difference in saving the life of someone with muscular dystrophy. Although there currently is still no cure, there is hope, and as long as those with muscular dystrophy take their disease seriously and realize that it is possible to live a life that doesn't involve complete physical deterioration, it is possible to beat the disease to the best of your capability and move on to live a very good life and enjoy your life and have it be the best one that it possibly can be. So thank you so much, and I appreciate your time, and I hope you enjoyed the presentation.